We're live.
Okay. Hi guys, good morning. April Lopez coming to you live from Retama Manor Nursing Home and Rehab Facility here in McAllen, Texas. So along the lines of our, am I loud enough? Can you hear me? Okay. Along the lines of educating, we're educating the community, we're educating our providers. The most important people to educate is nurses. And what better place than here? I love this place. It means a lot to me. I've been running here for 9 years. I run all the nursing homes. But I like to win service first family. And people here are family. My patients come here because people here care about patients. And I have great rapport with the nursing team here. They already know me. They text me. We take care of our patients well. And so we're going to be educating the nurses today on wound healing, head-to-toe assessments, skin assessments, prevention, early intervention for patients that, they change their status. Sometimes there's very subtle signs that the patient is changing. Nora I always talk about Nora when I talk about Retama. She's a very seasoned nurse, so she's like, hey, but something's going on with this patient. I don't know, there's something going on. So in geriatrics, remember guys, I'm board certified in family practice. I'm board certified as an adult geriatric acute care nurse practitioner. Means I run their hospitals, manage ICU patients. Geriatrician is a specialist in the younger patients. 55 and older is no longer geriatrics to me as I get closer to 55. But it is a specialty because patients this age range need different things. You're not going to see the expected fever spike. You're not going to see the very clear septic presentation of a patient. What you're going to see in a geriatric patient is a subtle change, an ever so subtle change. An ever so subtle change in blood pressure. If your patient was usually 150/90 and now he's 110/60, somebody might say, great, we have a good blood pressure. There's a huge drop in pressure. Your patient's already hypotensive for his norm, okay? And 150/90 is never my goal blood pressure, but it depends on the age range. You don't want to have a person that is 80 years old that is always dizzy at a 110/60 because they're going to fall. So that's where the geriatrician comes in. So it's very important that we educate our nurses as we have more people vaccinated, more people with antibodies. We're able to reach out again to the community and to the clinicians, and more importantly, the nurses, because we are at bedside. I was speaking last night at our dinner in Harlingen to practitioners and medical doctors, and I was saying how it's so different when the doctor comes in, he sees the patient, checks the patient, he writes an order, and he leaves the patient. We're bedside. The nurse will stay with your mom and your dad for 8 to 12 hours. If they're in a SNF, in a rehab, they're 24-hour care. Who better than the nurse actually knows what's going on with the patient? So those skills have made us the practitioner that I am now because I've been bedside for so long. Now I've been advanced practice for 9 years. So it's a very different mentality in how we look at how the patient is because we've been holding hands, we've been there. We're not just helping to change diapers, which we should be doing so we can assess the skin anyway and assess the full body. We're actually there clinically checking that the doctor gave the right order, that it makes sense, that the patient's creatinine clearance is good enough for that. Does he actually still need this Lasix or is he all dried out? Those are the things that you guys don't realize. Nurses are the ones that keep us alive, okay? Because everybody has a place in the healthcare system, and our place is to make sure people stay alive. So with that said, we're gonna get our education started, and have a great day.